Now, Tom Price is the head of Health and Human Services Department, and he's going to do a town hall on CNN about the Obamacare replacement bill that has a number of questionable things in it. Now, one of them includes the massive changes to Medicaid that Price is going to be asked about by a gentleman named Brian Kline. Now, Brian Kline happens to be someone who would be greatly affected by the change put forward in the American Health Care Act. Let's listen to his question.
Yes, Medicaid expansion saved my life and saved me from medical bankruptcy. Now, I earn $11.66 an hour at my retail job, and obviously I cannot afford to pay for my cancer care out of pocket. My life really depends on having access to my doctors and medical care. Getting a cancer diagnosis is bad enough, but Medicaid expansion gives me the economic security in knowing that funding is always going to be there for my cancer care. So my question for you, Secretary Price, is pretty straightforward. Why do you want to take away my Medicaid expansion?
Brian, thanks for that question, and thank goodness that things are going well from your healthcare standpoint. As a physician, I practiced medicine over 20 years and took care of a lot of patients with cancer, and it was one of those challenges that when it faces you as an individual or someone in your family, you want to make certain that you've got access to the highest quality care that you can receive. The fact of the matter is that we don't. We don't want to take care away from anybody. What we want to make certain, though, is that every single American has access to the kind of coverage and care that they want for themselves. If you look at the Medicaid program right now, we have 1/3 of the physicians in this nation, Brian, who are not seeing Medicaid patients. And so if we want to be honest with ourselves as a society, it's important that we step back and say, why is that? Why are those doctors not seeing Medicaid patients? And let me just suggest it's because the Medicaid program itself has real problems in it. And so what we want to do is, one, reform the Medicaid system, make certain that individuals who are currently on Medicaid or on the expansion either are able to retain that or move to a system that might be much more responsive to them through a series of advanceable refundable credits, a way to get coverage that they choose for themselves and for their family, not that the government forces on them. So thanks. It's wonderful that you have received the care that you've received, and it's because of the incredible innovations and great doctors across this land, but that's not necessarily true for everybody.
Yeah, look, you can see on this guy's face, he wasn't buying it. He's like, really? Really? You didn't answer my question. Look, what he did is do nothing but spout a load of bullshit. So let's break it down. Now, the changes that this bill put forward, the American Health Care Act, would be disastrous for Medicaid. First, it would essentially give Medicaid to the states in a block grant program. Now, a block grant is essentially a fixed amount of money per year. Now, for a while, that actually might work fine. However, as costs rise, as they do from year to year, well, that amount of money will not be adjusted to match. It is a strict block grant. It would have to go through, and they would have to pass it through Congress to raise that amount of money. So what would happen is that since it's very unlikely that Congress would continue to raise the money given to block grants through Medicaid, the states would either have to come up with their own money to cover the system, something a lot of poorer states would be unable to do because they have their own budget issues, and because a lot of the states are Republican run. And they tend to favor more tax cuts and less and try to use and loot their budgets, what they get from the federal government in money, to be able to plug their budget holes that they create from giant tax cuts. And they would end up, of course, these states would end up tightening eligibility rules, which would essentially mean kicking everyone but the most desperate people off the rolls. The people who are the poorest. People like Brian Kline. Brian Kline makes like $11 an hour. Okay? And that's not a lot, but under the old Medicaid rules, he would not be eligible for Medicaid. So, and I don't know if he would still be eligible, but certainly he wouldn't be able to afford cancer treatments if he lost that Medicaid program. And as you could see, of course, he wasn't exactly thrilled with that answer. So now I also want to address here one of the stats Price threw out about doctors not taking Medicaid patients. Now he says, man, we got a major problem with Medicaid because there are 1/3 of doctors that won't take Medicaid patients, and that's why we have to, quote, reform Medicaid. Now, of course, anybody who knows Republican speak, saying reform is basically saying, let's cut it. we're going to cut it and we're going to put the money elsewhere. And that's essentially what he says. Now, the thing is, he essentially wants to destroy a program that 2/3 of doctors take. If 1/3 of doctors doesn't take Medicaid, that means 2/3 do. Well, that doesn't make any sense. So it's overly beneficial in the long run. 2/3 of doctors take Medicaid. And you know, 1/3 they don't take Medicaid. That is a huge problem. That is a huge problem. Fascinating. Now, it's amazing how this guy tries to spin this, right? Now, what he wants to do, of course, and he mentioned this, is we want to give you tax credits. Well, tax credits don't help you when you're poor and have cancer. What tax credits do is benefit people who already have money. It's regressive, is what it is. Now, these credits, of course, are based on age, not income, which again benefits younger, more wealthier people who will end up saving quite a bit of money on health insurance, actually, if this bill goes into effect. Older, sicker people, and I broke down the numbers before, well, they end up paying a lot more. So, now finally, let's talk about how they're framing the changes to Medicaid, right? We want to give you a choice, but not what the government forces you to have. Well, that's an interesting way to spin this. Look, I know people on Medicaid. Not many of them feel like they're being forced to get health insurance, to get health care. In fact, a lot of them are very thankful to be able to finally be able to see a doctor. You take that away, they lose the ability to see a doctor. That's not a choice. You're not giving them a choice. Taking it away takes away their choice to see a doctor. That's the problem here. If you don't have money, you don't see a doctor, and that's what this comes down to. That's why, of course, Ryan Care, Trump Care, or whatever you want to call this bill, is an absolute unmitigated disaster for poor people. For people exactly like Brian Kline. Hey everybody, thanks for watching this video. If you want to see more like this, please hit the subscribe button below. And if you want to support truly independent progressive media, please consider becoming a patron at patreon.com/TYTNation.